Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other medical providers to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with medical providers since 2012. My passion for root cause medicine and provider advocacy drives me to help medical providers who have incorporated functional and integrative medicine into their practices. So let's dive in. Is Dr. Aaron Hartman, a board-certified family medicine and integrative and holistic medicine, and a certified functional medicine practitioner through the Institute for Functional Medicine. Dr. Hartman's journey into integrative medicine began in 2007 after he and his wife, Rebecca, adopted their daughter, Anna. When conventional medicine offered few answers, he began exploring alternative therapies, a path that transformed both his personal and professional life. In 2017, he founded Richmond Integrative and Functional Medicine to bring systems biology, nutritional therapy, and environmental medicine into truly personalized patient care. His clinical approach is rooted in science and guided by experience, helping patients uncover root cause and reclaim their health. He is also the author of Incurable: How Conventional Medicine Fails Patients with Complex Chronic Illnesses and What Integrative and Functional Medicine Can Do About It. A powerful resource for both patients and providers navigating chronic illness outside the conventional model. From the exam room to the regenerative farm he calls home, Dr. Hartman is deeply passionate about the interconnection between human health, the environment, and the food we eat. We're thrilled to welcome you to the show today, Dr. Hartman. Thanks for coming.
Well, thanks for inviting me. I'm excited to be here, Ginger, and just looking forward to our conversation today.
I love it. I love it. So let's dive in. So, I know you mentioned about your daughter kind of getting you into this, but tell us a little bit more about your professional background and kind of what led you. I know I saw that you were also in the Army. Thank you for your service. I see you've done a lot of pro bono work in third world countries. Thank you again for that service. So yeah, just tell us a little bit about your professional background and what got you here.
I started things very traditional, professional. Was a biology major, chemistry minor. Graduated summa cum laude from university. Went to the Medical College of Virginia. Just doing all the usual kind of things. You kind of physicians jump through hoops. In medical school, got an Air Force scholarship actually, and joined the Air Force, and then did full 4 years of active duty. So it was like 8 years total of active duty and reserves. And just doing the typical thing people kind of do. Ended up starting a research company, got published in Lancet. Been a clinical investigator for over 70 trials. So just doing a lot of cool things. But that pathway would have led me down the typical pathway of a typical academic family practitioner. Good skill set. One of the goals I wanted to do was actually be a physician, like a missionary physician overseas. So I kind of did stuff in Ecuador and Honduras and all over the place, just getting a lot of experience and stuff. But what really changed my career was adopting my daughter, Anna, who is actually a patient of my wife. My wife, Becky, is a pediatric occupational therapist, and we brought her into home. I really realized that for these complicated individuals who have more needs than our healthcare system can provide, navigating that was a totally different world, and it forced me to literally get 2 additional board certifications and hop off the beaten path and led me down this crazy road. And now I focus on taking care of complicated individuals who've been to multiple specialists and multiple doctors and were told there's nothing wrong with them, they can't be helped, and they come see me and we figure out, whether it's Lyme or mold or post-concussive syndrome or autoimmune issues or environmental toxins or whatever. And my daughter has changed my entire practice of medicine.
Can you tell us a little bit about your daughter and what her chronic or what her illnesses were that led you to this path?
Well, her birth mother did crystal meth throughout the entire pregnancy, and she had a stroke before she was born. And after birth, they realized she had brain damage. She was functionally blind when she was born. And actually, part of her brain, the corpus callosum, which attaches the left and right part of your brain, wasn't formed in her. So they said she'd never walk or talk or crawl. And my wife was one of her therapists that started seeing her out of the hospital. And when her foster home was closing down, my wife said, "Hey, would you consider bringing this little girl into our home and being her foster parents?" And I said yes. And trying to do the right thing, trying to feed her, et cetera, and doing everything the right way. And the GI doctor was like, "It's not good enough. The next thing, standard of care, is to put a feeding tube into her so we can pour formula water down her stomach." And we had to make a decision. Do we do the standard of care thing or we jump off the beaten path? And that's when we decided to say no. And we reported Child Protective Services. And that was my first entry into the world of what happens to you when you don't follow the instructions of the specialist and what you're supposed to do.
Wow. So they didn't like that you jumped ship from the traditional medicine models on her.
No, they didn't. And that for me, I'm a very, pragmatic fellow. I knew we'd figure it out. We weren't doing anything wrong. I mean, we were just trying to feed her real food. That's not the worst thing you could do for, a young child who has no home, right? But it was really 6 months later when my wife, doing her research, found a growth chart for kids with cerebral palsy, which is her official diagnosis. And she was actually 50th percentile. She was normal in the middle for her diagnosis. And that was like my aha moment when I realized the specialists don't know. The experts had no idea this growth chart existed. They're going to have her do a surgical procedure that would have absolutely changed her trajectory for health. And that was when I realized I had to be the person who figured it out for my daughter. I had to be the person who did the research to figure out what the best options for her were, because the system was just going to do surgical procedures, medications. I mean, to put things in perspective, the typical kid with her diagnosis, she's turning 20 now. The typical kid with her diagnosis has had 13 surgeries by the time they're her age, and she's had zero so far. So, and literally, we've done nothing the specialists have asked us to do, and she's thrived. So it's been a really interesting journey.
Yeah, tell us a little bit about her. How's she doing now?
She is killing it. She's actually my first kid that's going to be moving out of the home, actually in 2 months now, to Virginia Beach area to a place called Vanguard Landing. She still has significant needs. She is in a
Of
wheelchair,
course.
but she can do all of her ADLs. It's really funny. She's our timekeeper. She's our calendar. She tells everybody when they need to do stuff, where everything's, if you lose something, she knows where it's at in the house. She can do pretty much all of her ADLs, just needs someone kind of spot her to make sure she doesn't fall. But, from not going to walk, not going to talk, not going to crawl, going to be a vegetable in a chair your whole entire life, to literally moving out of the house and being functional and being a joy. People love her. I mean, she's a joy. She has an infectious laugh. She draws people to her by her personality. Like, these are two different outcomes. And the reason we have a different outcome is because we literally did a lot. We did everything we did was things that were not recommended to them. We had to figure out for ourselves what the best thing for her was.
That's amazing. And is she verbal now?
She's very verbal, sometimes too verbal. Oh, she's too verbal, actually. It's a
I
little,
love
it's like, my wife reminds me, like, we paid a lot of money and we prayed a lot of nights for this, so you need to be thankful. I'm like, I know, but oh my gosh.
Careful what you wish for.
I know. But it's a funny thing to laugh about, because it's like literally, yeah, you walk to him, hey dad, can you do this?
What a beautiful story, and what
Yeah,
a beautiful way to enter into this, what I like to call most scientific type of medicine that we have now. And that's really cool. I love that. So, we're going to go right into, since this podcast is for other practitioners, specifically MDs and DOs that are thinking about, hey, maybe I'll go into functional medicine. I'm hearing about it. My buddies are doing it. Maybe there's something more to this. Maybe I should be looking into this. So that's what this whole podcast is
okay.
about. So we want to talk a little bit about the business, even though I could sit here and talk about your daughter all day, because I think that is just such a heartwarming story. And based on, everything that you've shared with us, you're just a very awesome human being. So thank you
Thanks.
for everything that you've done for Anna, and for serving our country, and for all the humanitarian stuff that you do. But let's go ahead and dive in. So I'm sure when you decided to do this, to take on this new approach, there were some challenges you faced. Can you talk about those, and how you navigated those?
I mean, the biggest challenges are, when do you learn this? Like, if you're, getting to work at 7 in the morning, getting off at 5 in the afternoon, working evenings, weekend, like, when do you learn? When you get a second board certification, when you get a third board certification. So that was the first big hurdle, like, was, when do I learn all the things I need to learn for my daughter? And so I started getting up at 4 o'clock in the morning and just doing research, pulling articles, pulling Substacks, pulling stuff, which led me down to many pathways. I found out basically SNP testing, which is testing for little typos, and realizing I could give my daughter nutrients to actually address some of the genetic predispositions she had. And then after studying that whole field, that led me down to other field of Kurt Worrell, who's a pediatrician who deals mainly with autistic kids, and then realized, and that's where I started learning about translational medicine, which is taking these data points that seem unrelated and realizing, no, they are related. Folate receptor antibodies, folate receptor issues. Hey, leucovorin, like, there's really cool things you can do for these kids. And so that was the first hurdle, just like saying, hey, I need to wake up super early, stay up late to research my daughter. She's my research project. And then there's the money, like, and so just all of a sudden became an investment. Like, if I had extra money, I was buying courses. I was signing up for the IFM and A4M and all these other things. So the first two challenges were basically making time to figure things out, and then investing my own money into the research, into the study, to learn more about it, so I could start applying these things to my daughter.
What do you wish someone had told you when you first started practicing this way?
I wish I could have found someone like me now back then. Because what happens is you find like someone who's a gut expert or a mold expert or a Lyme expert, and they have these really narrow view sets, or a hormone expert or whatever. And it's like for a complicated individual, you have to be an everything expert. You can't just do mold, Lyme, brain health, gut health, neurotransmitters, peptide stem cells. You have to do like everything. And so I really wish I'd found someone who had like a super broad view. Instead, I had to find like the experts in the fields, jumping into different groups. And I'm still in a lot of those groups today. I'm learning from people. That's what takes a long time. And so because I worked so hard at it, I kind of sped the whole process up. So what would typically take, I finished my IFM training in 2 years and my A4M training in like a year and a half. Most people who do that training, they're usually spending, 3 to 5 years to finish any one of those. And so I really wish I'd found like someone like me who could have been like my guide, so to speak. But it was back then, back 2007, this wasn't a thing. It was quackery, right? It wasn't cutting edge medicine. It was craziness. And so we're in a different world now where actually literally people actually know what this is now. It's not all right, weird gut stuff. There's nothing to that. Now people realize, oh yeah, the gut, the brain, yeah, there's actually a connection.
So going back to what you were saying about finding the time, taking the time to get yourself educated, that is one of the things that you found most difficult.
That was the first challenge, was find the time to work, to figure things out, and then using my own resources. But once I figured out when to start practice, then there are other, how do you do this kind of medicine? How do you practice it? How do you create a practice behind it? So, but that was something I figured out 11 years later after I decided to throw up a shingle and practice this kind of medicine.
Got it. So what advice would you give other MDs or DOs who are thinking about adopting this approach to medicine?
I don't think first you need to learn how to do it. Where are you going to go and do a fellowship with us? I don't know of a place. Do you know of a place? So you kind of have to start practicing with your patients you're seeing currently and wherever you're at. So that's what I did. I started learning information, applying it to my daughter. And then all of a sudden I was like, well, this someone came in with chronic fatigue and fibro. And I read about yeast related fibro. Let's give this young lady some diflucan and see what happens. And this happened to me with a patient early on, and her chronic fatigue and fibro went away for like a month after a week of diflucan. So I was also like, wow, this actually works. And so I started taking patients who were open to a different way of looking at things and offering them, hey, I know your diabetes is high, or your peripheral neuropathy after chemotherapy is there. Would you be willing to try this? I actually had one patient, traditional patient, usual person, and he had a head and neck cancer. Got surgery, got chemo, and developed horrible neuropathy. So I did some testing on him, did organic acid testing on him, addressed all those things I found. Saw him back 6 months later, and I'm like, how you doing? He's like, oh, I'm doing fine. What about your neuropathy? He's like, I forgot I had that. Oh, wow. And it was like, oh my gosh, this actually works. And so as I was learning with my daughter, I started applying to patients and did that for several years and just started tuning and fine tuning and honing in my skill set in a different field of medicine.
Very cool. Very cool. And you mentioned, I want to go back to talking about kind of studying all of the different types of medicines. I often interview doctors that are overwhelmed with, what do they get fellowship trained in? Should they focus on the peptides? Should they focus on hormones? Should they focus on mold and toxins, environmentalness? There's so many. And, I'm finding that a lot of them are choosing to niche because I think it's really hard to be an expert in all areas.
It's the way I think about it is like, I agree with that, but also disagree. Like you can't do mold well unless you understand basic dietary things, sleep medicine. You don't understand detoxification processes, which is functional medicine 101. I mean, you need to know functional medicine 101 before you niche. I think what people are doing is they're niching before they learn the basics. They don't learn about dietary interventions, sleep, basic nutritional evaluation, basic fatty acid analysis evaluation, basic organic acids. And they're like going right to hormones. I'm like, great, my wife kind of jokes about it. Like it's a different form of green allopathy where it's like you're deficient in this hormone, I'm going to replace it. It's hormone replacement. I do hormone optimization. If you have hormone issues, the female, particularly middle age, it's like you have to look at the hormonal hierarchy. What's your cortisol look like? What's your thyroid? What's your insulin? How's your gut health? Because that's where most of these hormones are detoxified. Then focus on hormone optimization via replacement once those other foundations are laid. And what people are doing is skipping that whole process, going straight to the hormone course and doing hormone replacement, which will help a lot of people. But if you have someone who has multiple issues, multiple problems, then all of a sudden you have to know how to do the basic foundations well. And I feel like that's what people are being led now by more like social media influencers and stuff. When I did it, that wasn't a thing. I had to learn the basics first, the foundations first, find the gaps in my knowledge base, and then find those people and fill those in. And that's what I've done over, since 2007. So it's been a while.
I love that. I think that's super important to get the foundation, get your functional medicine 101. I think that is a great way to start. And then, yes, you can niche, but if you don't have the basics down, I like that we came back to that, because I was like, a lot of times I'll tell my doctors, like they get so caught up and stressed about taking that next certification, going to that next conference. And, quite frankly, sometimes they starting to get burnt out. And, most of my functional medicine doctors are super happy and are enjoying practicing medicine again. So I hate to see them get into that burnout scenario again. So I often tell them, you've got enough certifications, but with that said, you got to have the basics of functional medicine down for sure.
The great examples in peptides. I did my peptide certification several years ago. It was interesting while I was listening to Dr. Seeds, talk about different processes and this peptide, CJC, ipamorelin, and BPC, and whatever. And you're looking at the pathways, and you're like, oh, that's what HIIT does, high intensity interval training does, in fasting. So in this aha moment was, all peptides are cool. They're replicating what exercise and fasting do. Maybe the foundational stuff should be done first, right? Cleaner diet, maybe put some fasting in, exercise, and then, oh my gosh, peptides work amazing on top of that. And that's where I think people are getting, going to these peptide experts and getting peptides done. And it doesn't work that well. I mean, it helps a little bit. You lose some weight with the GLP-1, you bump it up, and now you're losing muscle mass, and now your face looks horrible, and you got chronic constipation. It's like you didn't do all this other stuff, and you're jumping to the peptide. And I feel like that's what people need to hear. And physicians, DOs, people that have licenses should learn this like they've learned any other fetal medicine. You learn your basic science first, you learn your basic chemistry, you learn your clinical aspect, and then you develop your practice. And people are skipping that and going right to, let me do hormones, peptides, stem cells, exosomes, whatever it is. And it's like, when do you use that? How? If it doesn't work, what do you do next? And they don't know those answers.
I love that you shared about Dr. Seeds. I have another, one of my clients actually is one of his students, and I hear his name often. And yeah, I agree with you. I think, there's so much out there, and it's so easy to get what I call shiny object syndrome, the next greatest thing. But if you don't have the basics, the foundation, you're going to struggle. Because even like you said, with the hormones, you can fix the hormones, but they might still have gut issues. They might still have other issues. So I love that you shared that. And I think that's a very important point that you made. What are some of the trends in functional and integrative medicine that you're most excited about? I know you are super into the science and really into studying this stuff. What are you seeing coming down the pike that you think other docs should be looking at?
I don't really know what the trends are because I don't pay attention to the trendy stuff. So
You're
usually I'm exposed
the trendsetter, doctor. You're the trendsetter.
So I went to A4M, their big conference. 9,000 people showed up for it this past Christmas and saw some of those things. But what I'm really excited about now is lipid therapy. Fat's back as of, a month ago now. Did you know fat's healthy for you again? The FDA just said it's healthy again, right? And it's like, we've been using this for neurocognitive issues, dementia patients, kids with autism, traumatic brain injury patients, women with hormone issues. It's interesting how much toxins are actually stored in fat tissue, and using phospholipids, using phosphatidylcholine, using TUDCA butyrate as chaperones to get out the toxins from your membranes. There's a whole field of medicine that's almost half a century old, using certain ratios of certain fats based on your testing, can have amazing responses. And I actually first got exposed to it in my SIRS training with about the mold stuff through Dr. Heyman, because they're using PC in mold patients and SIRS patients to help get the toxins out of their brain. And I connected that with Dr. Patricia Kane's work, and she was using it for kids with neurological issues 30 years ago. And so it's something that's super cutting edge, super complicated and basic at the same time, but no one's really talking about it right now because it's not sexy. But it's really interesting to learn case reports of an ALS patient who loses their diagnosis after 5 years of lipid therapy. That's pretty cool stuff. And I had a patient with post-concussive syndrome after 5 rounds of IV PC. They're fine now. and they've been sick for like a year and a half. So it's a really cool thing that can be implemented. And I think, dietary is first, right? Get all the healthy fats in your diet, get toxic fats out of your diet. But on top of that, you can do a lot of cool things like PC-TUCA, ursodiol, butyrate, glycerol butyrate, balanced omega-3s and 6s at medical doses that have really cool responses.
Very cool. And as a layman, I have no idea what lipid means, but I know that Dr. Billstrom, one of my clients, has been really big on TUDCA for a while now. I'm sure the doctors understand what lipid means, so we don't have to go into that. That's really cool. Thank you for sharing that. What is the one message you'd like listeners to take away about functional and integrated medicine? What would it be?
I think your audience of practitioners is, if this is something you're interested in, just dive in, sign up for an A4M course, sign up for an IFM course. But I will warn you, once you see the side, you can't go. If you're an ethical person, if you're someone who wants to do what's best for your patients, you won't go back. And I actually talked with a friend of mine, physician, talking with her, and she was like, I love what you do, but I can't study that because I know once I start learning these things, I won't be able to keep on practicing medicine the way I am. And that was like a pretty like slap in my face. Like, wow, like this is actually an ethical dilemma for many people. Like once you learn this, once Dorothy goes to Wonderland and you see it's the world's, color, it's not black and white. What do? Do you go back to the black and white world or do you stay in the color world? So I'll just encourage people to find some place, start getting educated, but beware, buyer beware. Once you do this, it's impossible. If you're a person of ethics and morals who wants to help people, who wants to make a difference in the world, you won't be able to go back.
Let's talk about that just for a minute because, my hope and, my vision is, with this podcast and educating other providers is that the medical schools will open their eyes to this scientific, type of medicine. I mean, we know that the med schools are not teaching nutrition. We know that they're not teaching a lot of the basics, foundations of functional medicine. And I'm hoping that that will one day be incorporated into a traditional MD and DO training in the near future. If it is, they start incorporating that. Is there a way forward for a traditional medicine doctor to still do traditional medicine with this tool bag?
Well, that's what I do. I'm still a regular medical doctor. I still worked in the hospital for over a decade. I still saw ICU patients and all kinds of fun stuff. And that still was part of my journey. But now the patients I'm seeing are more complicated. We have other issues going on. And so there is a way forward. I think medical schools could simply allow people to do a clerkship their fourth year, or even just have like a 1 week intensive where they learn like the basic 1 week. The Institute of Functional Medicine, it's called the IFMPC. It's their basic educational thing. That 100% would fit into a curriculum of medical school. And they actually are set up to do that, actually. But just the schools need to be open to it. And it's hard because there's a saying in science that science and medicine progress one funeral at a time, which is a fancy way of saying that once people are stuck in their ways, it's kind of hard to change it. So it's going to be a process, and the professors, physicians, administrators that are in these schools will probably have to move on before new people can come and say, I want to bring this education to our school, because that's just how medicine actually works via paradigms. Science is not scientific. It's not like people learn new things and practice them. It goes paradigm to paradigm. And so we're currently in a paradigm shift, and that can take sometimes a decade or two before it becomes the new standard.
I hope that it doesn't take that long. But with that said, let's say we get that incorporated. I think the biggest challenge is the push from big pharma, right? They don't want to see you guys stop using all the drugs and, treating people with nutrition and supplements. So, and I don't know how interconnected the med schools are with big pharma, and if that's what's holding it back, but it'll be interesting to see what the future holds.
And in my opinion, I think the biggest thing holding back people like me is medical malpractice. Like if I do something outside the standard of care, I'm scared. Like Lyme disease, great example. If you treat someone with antibiotics for more than 2 weeks, you might lose your license. That's kind of scary. And then insurance doesn't reimburse me for it. So until we remove the legal risk of doing something above the standard of care, which is what we do, it's above, like highly above the standard of care. And then also, how do you make money on it? How do you actually feed my kids, get my kids through school, pay for my bills for this kind of medicine? Until like insurances recognize it and say, we'll reimburse for that. And we lose the legal risk of it. It's going to be really hard for people like me to jump in. And so I feel like that's like the bigger thing. And once that happens, people won't, big pharma, I mean, you have like hundreds of thousands of doctors and millions of patients asking for this. They'll get out of the way.
That was an interesting point that you just made, that, you know, the medical schools and the insurance companies, I always say, from the insurance company side, when the insurance companies realize that this is preventative medicine, it's root cause medicine, it's healing the underlying condition and preventing disease from manifesting. I mean, think of the millions of dollars that they could save. So I think, they're starting to rise up to it, but they're, like you said, they're slow to process.
We have multiple patients with inflammatory bowel disease, their Crohn's, ulcerative colitis, that have gotten off their $30,000 or $40,000 a year medications, and they don't go to the hospital anymore, ER visits for abdominal pain and bloody diarrhea. They're not getting blood transfusions anymore, and the insurance has paid for none of their therapies, none of their supplements, none of the dietary things, none of the compound medications. I've literally saved insurance companies maybe $100,000 plus per person. If they once they see that, then yes, 100%, they'll be like, no, let's pay for this guy's stuff because I just say, if you pay me what you pay the podiatrists. I remember going to my podiatrist once, and it was like a 15-minute visit. You got $250 for that 15 minutes. I'm like, whoa, I just get reimbursed this. I can bill insurance all day long. We can do this, So I feel like once they realize that, realize we're at least as valuable as a podiatrist, which nothing against podiatrists are awesome, but it's just a comparison. Like once we get reimbursed at that rate, then I'll bill all day long insurance. But right now, 2 hours of my time, they pay 75 to $100 for it. And I can't keep the business open and feed my kids on $100 for 2 hours of my time.
No. And pay your malpractice insurance and your overhead and all the other things that come with running a medical practice. That's crazy. And yeah, I mean, I think the insurance companies now are still in this penny wise, dollar foolish mindset. But what? There's hope, right? That's why we have podcasts like this. That's why we're bringing education. That's why it's so important to me to have MDs like yourself come on this show, because nobody's going to listen if the MDs and the DOs don't speak up, because you guys went the traditional route and then you found a better way. And so you're the light. That's why I said you're the trailblazer. You're the one that's setting the trend. So thank you so much for being on the show today. I'm very grateful to have you on. And if you could share with us, the best way for, if a physician wants to reach out and say, hey, Aaron, want to just talk through, what this might look like. And also how can patients find you? Because we do have non-physicians that watch the show.
I mean, my landing page for all things me is aaronhartmanmd.com. And that takes people to my practice. It takes them to my precision medicine practice. It takes them to my book, Uncurable: From Hopeless Diagnosis to Defying All Odds. And that's uncurablebook.com. So I just say that's the hub, Aaron Hartman MD. It also takes people to my podcast and all those kind of things. Because I have all those bells and whistles and things. I have a YouTube channel as well. And so just that'd be the place to start, aaronhartmanmd.com. And then there people can choose which avenue they want to go to from there.
Sounds good. Well, thanks again for taking the time to be on the show with us and, share your experience and your hope with us on the show today.
Thanks a lot. I really enjoyed this time. Thanks for having me.